Every 2 seconds, somewhere in the world, a person has a stroke. By the time you finish watching this video, dozens of lives will have changed forever. Stroke kills over 5.5 million people every year globally and leaves another 5 million permanently disabled. It is the second leading cause of death on the planet. Those are not abstract numbers. Those are fathers who never came home from work, mothers who woke up unable to speak, 40-year-olds who had no warning, or so their families believed. Here is what nobody tells you clearly enough. Your brain does not stay silent before a major stroke. It sends specific, measurable warning signals, sometimes weeks, sometimes months in advance. The tragedy is not that those signals are invisible. The tragedy is that most people either miss them entirely or dismiss them as tiredness, stress, or aging. That stops today. Before we go further, if you are not yet subscribed to this channel, please do that now. We are working toward 100,000 subscribers, and every person who joins helps this medical education reach someone who genuinely needs it. We also have a Telegram community where Dr. Chima Okoye shares free health checklists you can use at home. The link is in the description. Join it. It costs you nothing and could matter more than you realize. Now, here's the first thing you must understand. Stroke is not a random event. It is not lightning striking without warning. It is the predictable endpoint of years of slow, quiet damage happening inside your blood vessels. Damage that builds steadily until one day the system fails. That means stroke is, at least in part, preventable. And prevention begins with knowledge. There are 2 types of stroke. The first is hemorrhagic stroke. This is when a blood vessel inside or around the brain ruptures and bleeds. It accounts for roughly 13% of all strokes. The second, and far more common, is ischemic stroke. This is when a blood vessel becomes blocked, cutting off the blood supply to part of the brain. Ischemic stroke accounts for approximately 87% of cases. Because it is overwhelmingly more common, and because its warning signs are the ones most people miss, it is the focus of everything we are covering today. To understand why a blocked vessel is so dangerous, you need to appreciate what the brain actually demands. Your brain weighs about 3 pounds, roughly 2% of your total body weight, yet it consumes 20% of all the oxygen and glucose your body produces. Think of it like a city the size of a small town running on electricity meant to power a major metropolis. The moment that power is cut, everything shuts down. Not gradually, not politely, immediately. When blood flow to the brain stops, neurons begin dying within 4 minutes. Every minute of delay costs approximately 1.9 million brain cells. There is no recovery buffer. There is no grace period. This is where the concept of a TIA becomes critically important. TIA stands for transient ischemic attack, sometimes called a mini stroke, though that name dangerously undersells it. Here is exactly how it happens. Imagine your carotid artery, the major vessel running up the side of your neck, delivering blood to your brain. Over years of high blood pressure or high cholesterol, plaque builds up along that vessel wall. A small fragment of that plaque breaks free. It travels upward, temporarily blocks blood flow to a region of the brain, and symptoms appear suddenly. Maybe your vision blurs on one side. Maybe your arm goes weak. But then the clot dissolves on its own, blood flow returns, and the symptoms vanish. You feel fine. That disappearance is not reassurance. It is a warning. Within 72 hours of a TIA, the risk of a full, devastating stroke peaks sharply. That window is everything. And the 5 signs that tell you a TIA or something worse may already be in motion are exactly what we are about to cover. The first warning sign is one that sounds alarming enough that you might expect everyone to act on it immediately. Most people do not. It is temporary blindness in one eye. Picture this. You are sitting at your desk or driving or simply looking across a room, and suddenly a gray curtain drops across the vision in one eye. Not both eyes, one. It lasts seconds, maybe 30. Then it lifts and you can see perfectly again. You blink a few times, decide the light was strange, and move on with your day. What just happened inside your body is this. The ophthalmic artery, the blood vessel feeding your eye, branches directly off the internal carotid artery, the same vessel that supplies a significant portion of your brain. When a fragment of plaque breaks loose from a narrowed carotid and briefly blocks that eye artery, vision vanishes like a power cut to a single room in a house. The medical term for this is amaurosis fugax, from Latin meaning fleeting darkness. It is not an eye problem. It is a brain supply problem wearing an eye symptom as its costume. Neurologists consider it a TIA of the retina, and it carries the same 72-hour stroke risk as any other transient ischemic attack. Do not let the fact that your vision returned convince you that everything is fine. It is not. The second warning sign is sudden one-sided numbness or tingling, and the dismissal here is almost universal. You feel pins and needles in your left hand, or your right cheek goes strangely numb, and your immediate thought is that you slept awkwardly or sat in one position too long. Here is how you tell the difference. When you sleep on your arm and compress a nerve, both hands may go numb unevenly. The sensation is dull and generalized, and it resolves the moment you move. What stroke-related numbness looks like is different in a specific and important way. It is strictly one-sided. One arm, one leg, one side of the face, sometimes all three on the same side simultaneously. That pattern reflects something precise. The brain's sensory pathways are organized so that one hemisphere controls the opposite side of the body. When blood flow to one hemisphere is disrupted, the signal dropout is clean, one-directional, and sudden. Think of it as a circuit breaker tripping on exactly one side of a building. Not a general flicker, but a specific, contained failure. If you ever feel sudden unilateral numbness that you cannot explain by position or pressure, treat it as neurological until proven otherwise. The third warning sign is a sudden loss of coordination or balance. You stand up and the room tilts. You reach for something and your hand misses. You feel unsteady in a way that has no obvious cause. You are not dizzy from standing too fast. You did not spin in circles. You simply feel wrong in space. The structure responsible for your balance and coordination is the cerebellum, a dense cluster of neurons at the back of your skull. It is fed by a network of vessels called the vertebro-basilar system. Simply put, arteries running through the back of your neck and into the base of your brain. When those arteries narrow or become briefly blocked, the cerebellum misfires. The key distinction here is this. Benign positional vertigo, which many people experience, is triggered by specific head movements and tends to be reproducible. Stroke-related dizziness appears without a trigger, often with other symptoms alongside it, and has a sudden, spontaneous quality that feels distinctly different from anything the person has experienced before. If the dizziness arrives uninvited and brings company, numbness, vision changes, slurred speech, that combination is a neurological emergency. The fourth warning sign is a breakdown in speech, and this one requires careful explanation because the dismissal is seductive. Everyone has moments of forgetting a word mid-sentence. That is normal cognitive traffic. What you are looking for is categorically different. Broca's area, located in the frontal lobe, produces speech. Wernicke's area, in the temporal lobe, processes language comprehension. When blood flow to either region is interrupted, the failure is not a tip-of-the-tongue hesitation. It is a collapse. Words come out in the wrong order. Familiar words become inaccessible. Or speech sounds fluent but makes no logical sense, even to the person speaking. Here is the critical clinical point. Even if the speech corrects itself within minutes, that self-correction is not reassurance. Think of a home alarm that sounds for 30 seconds and then stops. The alarm stopping does not mean there was no intruder. It may mean the system is failing. transient speech disruption that resolves is still a medical emergency. The brain reset itself temporarily. That does not mean the threat has passed. The fifth warning sign is more nuanced, and it asks you to look at your skin and your headaches together rather than separately. If you've noticed patches of skin losing their pigment, a condition called vitiligo, current research links this to autoimmune activity that also damages the endothelium, which is the smooth inner lining of your blood vessels. A healthy endothelium behaves like a non-stick pan. Blood flows cleanly, nothing adheres. Chronic inflammation, high blood sugar, and autoimmune processes roughen that lining the way heat damage ruins a non-stick surface. Plaque begins to stick. This is why new or unusual headaches in someone with skin autoimmune changes deserve serious attention. And here is something equally important. Arthritis in the small joints of the cervical spine, the bones of your neck, can compress or irritate the vertebral arteries, producing headaches that feel vascular but are actually mechanical in origin. This matters because treating the wrong cause delays finding the right one. New headaches need decoding, not just numbing. Before we continue, consider this, and this is a myth worth stating plainly. Normal cholesterol does not mean you are safe. High blood sugar, even in the pre-diabetic range, is independently damaging to vessel walls. Smoking introduces over 7,000 chemicals directly into your bloodstream, many of which strip the endothelium bare. And blood pressure carries a paradox that surprises most people. In someone whose arteries are already narrowed, a nighttime pressure drop, which is normally healthy, can actually reduce flow through a compromised vessel enough to trigger a stroke during sleep. Stroke is not only a disease of old age. Between 10 and 15% of strokes occur in people under 45, and vascular damage does not wait for retirement. It accelerates quietly through your 40s, shaped by decades of daily choices and biology. So let me ask you directly, how old are you right now? Because what comes next applies to you regardless of the answer. If anything you have heard today matches something you have experienced recently or even months ago, the 72-hour window is not a countdown to fear. It is a second chance that most people never realize they were given. Use it. The first practical step is simple. Do not be alone. After a suspected TIA, the risk of a full stroke is highest in the hours immediately following. If symptoms return, you need someone physically present who can recognize the change and act. Tell a family member or a close contact what you experienced today. Show them this video if that is easier. Make a plan in advance so that if something happens, no one is standing still wondering what to do. Do not drive. This is not a suggestion. A second event behind the wheel puts you and others at serious risk. Speak to your doctor before resuming driving and arrange alternative transport in the meantime. Know your blood pressure numbers. If you're systolic, the top number reaches around 180, or you're diastolic, the bottom number reaches around 110, that is not simply high blood pressure. That is a hypertensive crisis, and it requires emergency assessment, not a painkiller and rest. And hear this clearly. Do not take blood thinners on your own initiative. The two types of stroke require opposite treatments. A clot-dissolving medication given to someone with a bleeding stroke can be fatal. Only a CT scan, a detailed brain image, can tell the difference. That decision belongs in a hospital. While waiting for help, lie flat. Elevate your legs slightly if possible. Keep your head in a neutral position. Avoid smoking, alcohol, and hot baths in this window. Each one alters blood flow in ways that increase your risk. Knowledge without a next step is just anxiety. So here are 3 specific investigations you can ask your doctor about by name. The first is a carotid duplex ultrasound. A basic ultrasound shows the structure of your carotid artery, the major vessel in your neck feeding your brain. What the word duplex adds is blood flow mapping on top of that anatomy. Together, they tell your doctor not just whether the vessel is narrowed, but how severely and how that narrowing is affecting circulation. If stenosis, meaning narrowing, reaches around 70% or more, you have lost nearly 3/4 of that vessel's effective capacity. At that level, a procedure called carotid endarterectomy, where a surgeon carefully clears the plaque from the artery wall, becomes a genuinely life-saving option. It sounds daunting. It is, in experienced hands, a routine and well-established procedure. Ask whether your vessels have been imaged recently. If the answer is no, that is your starting point. The second test is an HbA1c blood test. A single fasting glucose reading tells you what your blood sugar was doing on one particular morning. The HbA1c gives your doctor a 3-month average of blood sugar control because glucose binds to red blood cells over their lifespan, leaving a measurable record. This matters because vessel damage begins in the pre-diabetes zone before a formal diabetes diagnosis. A normal HbA1c sits below 5.7%. The pre-diabetes range runs from 5.7 to 6.4%. A result of 6.5% and above indicates diabetes. If you are sitting anywhere in that middle range, your endothelium, the inner lining of your blood vessels, is already under stress. That is the zone where prevention still has significant power. The third is Holter ECG monitoring. A standard ECG taken in a clinic lasts seconds to minutes and captures your heart rhythm only in that moment. Atrial fibrillation, a condition where the upper chambers of the heart quiver chaotically instead of pumping in an organized rhythm, is often intermittent. It can be completely invisible on a short clinic recording. A Holter monitor is worn for 24 to 48 hours, recording continuously. When AFib is present, the chaotic rhythm allows blood to pool and clot inside the heart. Those clots can travel directly to the brain. The clinical significance is this. With correct anticoagulation, blood thinning medication prescribed by a physician after a confirmed diagnosis, stroke risk associated with AFib can be reduced by 60 to 70%. That is not a small number. That is a choice made possible by a diagnosis. 3 things reduce your stroke risk more than anything else discussed today. Controlling blood sugar, catching it early in that pre-diabetes window before the vessel damage compounds. Managing blood pressure, not just lowering it, but avoiding the paradox of overtreating it in someone with already narrowed arteries. And stopping smoking, because that single change reduces stroke risk by 2 to 4 times compared to someone who continues. These are not comfortable numbers. They are motivating ones. Here is your specific action step for today. Before you open another app, write down any warning signs from this video that you recognize from your own past. A curtain across one eye, a moment of strange numbness on one side, an episode of slurred words that resolved quickly. Write it down with an approximate date if you can recall one. Bring that written list to your next doctor's appointment. Ask specifically for a carotid duplex ultrasound, an HbA1c, and a Holter ECG monitor. Those 3 questions, asked clearly, open a different quality of conversation. One important note, everything covered in this video is medical education. It is not personal medical advice, and it is not a substitute for an assessment by a physician who knows your full history. Use this information to start a better, more informed conversation with your own doctor, not to replace that conversation. If this video gave you something useful, a name you did not know, a symptom you recognized, a test you will now ask about, please subscribe to this channel. We are building toward 500,000 subscribers, and every person who joins means this information reaches further. Like this video so the algorithm understands it deserves a wider audience. And scan the QR code on screen now to join Dr. Chima Okoye's Telegram community, where free health checklists are waiting for you, including one that covers everything discussed today. Your brain has been working without interruption since the moment you were born. It deserves your attention before it asks for it urgently.